Physical therapy is a big component when it comes to breast cancer. After surgery, doctors say women may find the area around or near their breasts is painful or tight, and so the struggle continues.
The following segment is sponsored by Geisinger Holy Spirit.
I do this about 10 times. I just move the lymph nodes this way.
Just this past February, Nancy Martyr was diagnosed with breast cancer.
I found a lump just by accident.
A good accident. She caught it early enough that it had not yet metastasized. Nancy had a lumpectomy to remove the cancer, but had to undergo another surgery after that.
At first, there's such a sense of not believing it's really happening, and it's so completely life-altering.
She did 7 weeks of radiation and was lucky enough to avoid chemotherapy, but she couldn't avoid physical therapy.
So she did have a lot of adhesions and a lot of lymphedema in her breast.
Physical therapist Kim Lanker worked with Nancy to alleviate some pain and tightness in her chest and arm, stemming from scar tissue buildup under the skin, also known as adhesions.
Very painful. It can really limit the ability of that patient to use their arm and function as they did prior to surgery.
Lanker performs myofascial release and manual lymphatic draining, lightly massaging Nancy near the lymph nodes to relieve the adhesions and get the lymphatic fluid flowing. Nancy has learned how and now does this at home herself.
I go over to my ears, and then I go from my ears down again back to this hole.
Since this will be something she'll always have to deal with.
She's taught me so much about my physiology, especially the lymphatic system, and what she needs to do and what I need to do to keep me healthy.
Nancy goes to physical therapy about once a week, but her PT says she's made such great progress, she probably won't have to come for much longer. With this week's Doc Talk, I'm Lara Greenberg, CBS 21.